Portals of exit. How do I get out of the body if I've infected somebody? Generally, they're going to be the same as the portal of entry, but science, so not always. Pathogens generally leave the portal of exit through secretions like nasal secretions, excretions, things like human feces, discharges, or even sloughed off tissue. The higher the number of pathogens that use the portal, let's say a sloughed off piece of skin, the higher the number of microbes on that piece of skin, the more likely it is that it will infect the next person it comes into contact with. The transmission is more likely the higher the number that are exiting through these portals. So we've got coughing and sneezing, we've got vectors like mosquitoes, we've got skin cells or open lesions where there's infection there. We've got urine that has, a UTI, fecal material, even the blood, HIV. In the late 60s, early 70s was when HIV really became fairly prominent enough that we realized it was there. Sadly, because it was in the gay community, nobody paid attention, even though it wasn't specific to that community. It had nothing to do with that, other than the transmission, how it was transmitted. The worst part of that was that they didn't realize it could be transferred through blood products. So if you got a transfusion, they weren't checking to see if HIV was there. If you were an IV drug user and you shared needles, it was a quick way to get it because it was a blood product. The stages of an infection. You have the incubation period, the prodromal stage, the period of invasion, and then the convalescent period. Incubation period. It's the time from the initial contact with the microbe to the actual appearance of symptoms. The length of the period depends on how healthy the host is, what specific microbe invaded your body, what the initial dose was, and what the portal of entry was. Generally, incubation can be anywhere from 2 days to 30 days. Remember that if a microbe invades your body, it has to have a time frame to establish itself. If you get 1,000 gonorrhea microbes, those 1,000 need to replicate in order for you to feel it. It's not enough just to have that 1,000. That's the incubation period. The prodromal stage, 1 to 2 day period where the earliest symptoms appear. Symptoms are very mild in general. I'm kind of achy, my stomach hurts, I'm tired, but it's not full blown, oh, I know what this is. It's, I don't know, I just don't feel good. That's the prodromal stage. Usually, like I said, 1 to 2 days. It's not a very long stage. Then you have the period of invasion. The microbe is multiplying and it's at high levels. So those signs and symptoms that I was talking about are now very pronounced. They're the most pronounced that they're going to be in these stages. This period can vary in length depending on the host's health as well as the specific microbe. There's a difference between getting infected with a cold and getting infected with Ebola. The convalescent period. This is when the host's immune system is responding to the infection and the symptoms start to kind of go down. You start to kind of feel better. Not at 100%, but you're getting back to 100% because your immune system is actually fighting this off. The patient's strength and health will gradually come back to normal. So convalescent means that you're healing. You are getting better. Some microbes can be transmitted only in certain stages of infection. Others can be transmitted during any point during the infection. I may not be contagious when I'm in the prodromal stage, or I may only be contagious in the padronal stage. COVID, yeah. The scary thing with COVID is a lot of people who weren't showing symptoms yet were spreading the virus. So they were probably in the prodromal stage where they kind of generally didn't feel great, but they didn't notice that, oh, I'm totally sick. So they were spreading it. There are other diseases that until it's established, you're not going to spread it to anybody. Just depends on which one it is. Science. Terms associated with the spread of a disease. A reservoir is a natural site of the pathogen. Where does it normally reside? Is it in humans? Is it in animals? Is it in soil? Is it in water? I talked about tetanus earlier. I talked about lockjaw. That is normally found in soil. Yes, soil can get on things and you can puncture yourself with those things, but the actual pathogen is in the soil. It's not in a human. It's not in an animal. It's not a rusty nail. It literally is from soil. What is the place where that thing resides? That's the reservoir. Transmission route. How is it transmitted? Is it through direct contact or indirect contact? I have to come into contact with somebody. Directly would be like HIV. I would need to come into direct contact with someone. Indirectly may be, I didn't wash my hands after going to the bathroom. I touch a doorknob. You touch the same doorknob and then eat something and don't wash your hands before you do it. That's indirect. You still got sick, but I didn't go and put my hand in your mouth. A vehicle. This is through food, through water, through air. Sneezing and the droplets go out and you breathe them in. That's going to be a vehicle. A vector is through some type of intermediate. The most common that we kind of associate is the mosquito for things like malaria. Malaria doesn't get passed person to person, but if a person is infected, a mosquito comes and bites them, they pick it up. Things happen in the mosquito to make it mature enough that when they bite another person, it gets transferred. That's a vector. There has to be an intermediate between the two hosts. Nosocomial infections. These are infections where the hospital is the source of the disease. Nosocomial infections are hospital-acquired infections or healthcare-associated infections, HAIs, are literally acquired during a hospital stay. You don't have it, but you go to the hospital and you have it after. An average of about 5% of patients will develop nosocomial infections during a hospital stay. This leads to an increased length in the stay at the hospital, increased cost for staying at the hospital. Even it can lead to death depending on the health of the patient. The hospital is kind of the perfect storm for infections to happen. You have people that are already compromised in the hospital. They are being admitted into the hospital. You have multiple pathogens, multiple sick people, different with sick things that are in the hospital. So the potential for having that infection around, for having multiple infections around, exists just because of the nature of a hospital. Lower defenses may allow normal biota to also invade the body. If you're already sick, your immune system's already busy. It's kind of one way that opportunistic infections can take advantage because your immune system's already busy. Let me get in now. Types of procedures used in hospitals. Treatments using reusable instruments, indwelling devices like catheters or even skin grafts, and high use of antibiotics can actually increase the chances of encountering some type of antibiotic resistant strain of a disease, again, if somebody's already in the hospital and they're being treated and it's not working, I'm going to keep trying different things. And as I try those different things, I'm selecting for things that are antibiotic resistant. It's not intentional. I don't want you to think hospitals are doing this on purpose, because that's not it. But it does happen because, like I said, it's the perfect storm. I've got sick people who are already kind of immunocompromised. I've got multiple different diseases that are floating around the hospital because I've got multiple sick people. Those people that are sick have lower immune defense. And a lot of times I'm using indwelling devices. If you've got surgeries where you catheterize somebody so that they don't wet themselves, that equipment is usually reused after it's cleaned. Whether it's cleaned properly is the question. What are the most common of these infections? The most common is usually a urinary tract infection, and again, it's often associated with catheterization, there we go. Surgical site infections, as well as respiratory infections, run a close second and third. So you've got urinary tract taking up 40% of this pie. You've got surgical site at 19 and respiratory at 15. Top three. What microbes are most associated with these? Gram-negative intestinal biota are recovered from samples in more than half of the patients that have this type of infection. The other half of patients are actually harboring staphylococci or streptococci, including enterococci or yeasts. It's just opportunistic that they take advantage of the fact that their immune system is kind of compromised. What can we do to control this? What can we do to control nosocomial infections? The number one method for controlling these infections: hand washing techniques. Proper hand washing techniques. Other ways we can help to control nosocomial infections while working in a hospital. Clean gloves are going to be used with each patient to prevent contact with the patient's blood or body fluids or transfer microbes from one patient to another. Stringent aseptic techniques when working with patients. Degerming before you inject or you catheterize a patient. You need sterile equipment and materials when performing any invasive procedure. I don't think that's a big 411 to anyone. Stringent sterilization, disinfection procedures for the rooms of the patients, for the bedding of those patients, for the breathing apparatuses of those patients. Imagine going into a hospital room, you already feel bad and they haven't changed the sheets from the previous patient that died from pneumonia. Yeah, that wouldn't be a good thing, right? They have huge washing machines. They use bleach. There's a reason everything is normally white in a hospital, because they are doing their utmost best to make sure the room is clean, the sheets are clean, the bed is clean. All of these things have to be taken into account when you work in a hospital, because you do not want an infection going from one patient to another when you can easily avoid it by cleaning things.